Now, COVID-19 is having a catastrophic impact on the most vulnerable communities around the world and threatens progress around HIV, TB and malaria. That was the stark message from the Global Fund to fight AIDS, tuberculosis and malaria that has provided funding of $1 billion to help countries fight COVID-19 while mitigating the impacts on existing life-saving programs. This comes after a joint statement earlier this month from UNAIDS and the World Health Organization warning that more than 500,000 extra deaths from AIDS-related illnesses could impact sub-Saharan Africa if interruptions brought by the COVID-19 pandemic are not resolved. Well, for more on this now, we're joined by the Global Fund's Head of Civil Society and Political Advocacy, that's Linda Mafu from Geneva. Ms. Mafu, thank you very much for joining us. This has been the big fear, hasn't it, that we will lose, we will fight COVID-19, but then possibly lose other battles. What are you seeing in the midst of this pandemic, particularly in the African context?
Thank you so much for having me. As you have already highlighted, that it is an unparalleled global health issue that we're facing. The pandemic has really showed us huge spotlight in terms of the health systems. Our health systems are relatively very weak in Africa, and we're already struggling with dealing with some of the existing pandemics, including the epidemics around HIV, TB, and malaria, as you have highlighted. Now, the challenge again is that there are many inequalities in terms of access to healthcare already. If you are talking about access to some of the healthcare services for young people, access to some of the healthcare services for that generation, it's a challenge. Our healthcare systems are not coping. We're also seeing a huge challenge in terms of access to just food security, because you cannot take treatment if you don't have access to food. That is challenging. So those are some of the things that we see. Our laboratories are not very strong. They don't have the capacity to respond to some of these challenges, particularly because we need to have tests, we need to have information, we need to have everything, but it's not working at this point in time. There are huge challenges.
For AIDS specifically, and TB as well, not taking medication is bad enough, but then there's that concern of drug resistance. How big is that concern right now as well?
There's a huge challenge already and a huge concern around that. The challenge number one is the potential disruptions, and we have seen in other countries they have started already. People are unable to go to the healthcare facilities and access their services. Even in terms of access to condoms, because of the disruptions, we may be facing a huge number of new infections. After this, we will deal with COVID. However, we will have to deal with a huge number of new infections and therefore a huge demand for treatment. So that is another challenge that we're having. Also in terms of malaria, it's the same thing, because the campaigns to ensure that communities have access to bed nets that are able to then protect our young people, also our communities in general. There are disruptions there, and therefore we will look at a point of having double numbers of deaths, but also double numbers in terms of new infections.
Sure. I mean, this is staggering, and we haven't even looked at vaccines not taking place. Gavi, the Vaccine Alliance, saying at least 13.5 million people could miss out on vaccinations. What does that say about the road ahead?
It's going to be very, at this point in time, we call it side effects of COVID. It's going to be a really, really long walk to freedom, basically, because one, to just manage in terms of maintaining the number of people that we have on treatment is a huge struggle already in terms of our healthcare system. However, beyond the COVID, just to deal with the new infections, to deal with the support that is needed for all the people that may be having a lower CD4 count. Also in terms of the fact that people may be having, no access at all to some of these services. But also, just in terms of getting people to healthcare services is a challenge, and it will continue to be a challenge. And that means we will have people that are living with HIV and do not have access to treatment. We will have TB issues as well, multi-drug resistant TB, and therefore, again, it will be reversing the progress that we have made in the continent.
So are you talking to governments? I mean, everybody's trying to do their best. The lockdowns aimed at COVID-19, like you say, with these side effects. Are enough people aware of what can happen here and doing something about it?
We need a couple of things. We need the government to be decisive and to act swiftly. They have done a lot of work in terms of responding to COVID-19, to mobilize resources and all of that. However, we need information that is consumable to communities so that communities know how to protect themselves, so that communities understand the potential impact of COVID-19 beyond the pandemic now. So we also need to work with government, and we are working with government in terms of using the limited resources in an efficient and effective way, making sure that they are implementing programs that will curb the pandemic, that will ensure that the existing epidemics, that is HIV, TB, and malaria, are also managed. We don't lose focus on those epidemics because they will come back to bite us badly.
And a huge focus must be on mothers and educational awareness to take those kids for vaccinations.
Yes. So in terms of vaccinations, again, one of the challenges that we've seen in a couple of countries is that because the vaccination are not seen as a huge problem at this point in time or as an emergency. So the habits of going and seeking services in the healthcare facilities is not encouraged. So people are not going for vaccines. And yet one of the important messages that we need to provide to our communities is that all the vaccines that are needed by our children, they should access those services. They should access those vaccines. Otherwise, we will really have huge problems afterward.
Finally, we often talk in our coverage about what will happen when we reopen economies. What will things look like? Health systems in Africa have been a huge focus, concern around that. I mean, is there any silver lining that they could be strengthened through this, emerging from the pandemic better?
That's a big if. So if our governments now, as they are receiving a lot of support from different partners, particularly financial support, if they invest those resources to make sure that they build resilient and sustainable health systems for health, that will be very important. So whatever resources that are existing now, they have to be invested in healthcare systems. They have to be invested in human resources for health to ensure that we have those 30,000 healthcare workers from South Africa going door to door to support, but also continue beyond COVID. We need to make sure that we invest in a way that build our health system, including the community systems, because without engagement of community, meaningful engagement of communities, we will not be able to defeat these diseases within our public health systems.
All right, thank you very much for your time tonight. A stark warning about the side effects also relating to health if there is too much focus on COVID-19 and we regress in the fight against other diseases. That was the Global Fund's head of civil society and political advocacy, Linda Mafu.